Hello, welcome or welcome back to my channel. Today I am coming to you live here to discuss medical advocacy and why it's important to you, the patient. This video was inspired by Jessica Petway's story. She was one of my favorite YouTube influencers that I would watch back in the day. And she is someone who was incorrectly diagnosed, shall I say, with uterine fibroids when she actually had stage 3 ovarian cancer. I made this video just so that you all know your rights as patients and how you can get second opinions to ensure that you're getting the proper information that you need from your doctors. Taking control of your healthcare can help boost your confidence and also just make your life overall better. Advocating for yourself in the medical setting is important because it improves your outcome, it ensures the quality of your care, prevents medical errors. So when it comes to advocating for yourself, first thing you need to do is participate in discussions with your doctor. You don't just want to allow the doctor to make decisions for you without any type of input. Have a back and forth with your doctor. Have questions. Be able to speak to that, right? And when I say speak to that, I mean be able to describe it in a way that makes sense to them. You need to have a basic understanding of the ailments that you have, the area of your body that the ailment is in, and possible causes of that and what could be happening. You also need to be self-aware enough to know if there's something that you're eating, doing, or putting on your body that may be causing it. So that's just doing a quick Google search. We all have smartphones. Be smart and speak up and voice your opinions. You should never feel intimidated by your doctor. Although they are a doctor, that does not mean they are better than you in any way, shape, or form. That does not mean they have anything over you that will allow you to not be able to have your own agency over your body. You need to be able to speak up, voice your opinions and concerns. Knowing your rights as a patient. So you do have rights when it comes to your interactions with doctors in a medical setting or any type of medical professional. You have the right to informed consent. You have the right to a second opinion, and you also have a right to access your medical records. So a little bit about informed consent. Informed consent is the process in which a patient is given as much information as possible by their medical care professional to make an informed decision on the next steps. If your doctor cannot provide you with enough information or answer any probing questions that you may have, fire them, get a new one. HIPAA is the Health Insurance Portability and Accountability. Basically, the right that you have to access your medical records, whether that be through paper or electronic. Now, it's 2024, so a lot of the doctor's offices have portals that their patients can access their medical records. In those portals, they will have a list of the appointments that you had with the doctor, things that you discussed, possible diagnoses, current diagnoses, medications that you take, and a summary of the conversation. If the doctor provided you with instructions to go get any type of testing, if you have the results for those tests, they will also be there. That just gives you more power to be able to access your record, pull information that you need. If your doctor's office has a medical portal, I would encourage you to go ahead and sign up for that. You want to keep a record of conversations that you have with your doctor, to write down the dates and times, things that you all discuss, and terms that you may not know or that are introduced to you. And take that with you, and then as your homework, you would go and Google anything that the doctor said to you that you're not familiar with to get a better understanding. But you need to keep a record of discussions that you have with your doctor. You have the right to seek a second opinion. So that just means if you don't like what the doctor is saying to you or something seems off, you have the right to go and seek assistance elsewhere. That could just be as easy as scheduling an appointment with a different doctor. You are not beholden to anyone, especially when it comes to your health and your body. Even if you have to travel, you can seek help elsewhere. Traveling to a medical care provider that you know can provide the best care possible to you, benefit outweighs the cost. If you can get quality care, why not? You're paying for it, your insurance is paying for it, you're paying your insurance company. So why stick with somebody that is not providing you the care that you need or that you feel that you need. If they're giving you information that doesn't sound right or seem right, seek medical help elsewhere. Fire them and move on. So we're going to talk a little bit about effective communication with your medical care provider. You can do so by being able to speak to what you're experiencing. Be able to describe it to someone in a way that makes sense. If you need to Google your symptoms to look up the actual medical terminology for it, that may help them. You need to have a basic, and by basic I mean basic, a basic understanding of the part of your body that you're having an issue with, possible causes of those, and symptoms that you have. You need to be able to communicate this to your doctor in a way that makes sense. Use complete sentences. Don't be rude. Don't be unprofessional. Remember, even though you're going to the doctor, you still need to have a certain level of decorum. Nobody wants to help anybody that has an attitude problem, a nasty mouth, or is just rude and nasty. Be pleasant. If you can't be pleasant, be as pleasant as you can be in that moment. I know sometimes you go to the doctor scared, you're frustrated, but you need to maintain a certain level of, as my mom would say, cool when you're speaking to your medical care professional. Don't be intimidated by them. Just because they're a doctor doesn't mean that they're better than you in any way. We're all humans. We're all experiencing the same thing. They need to be able to put however it is that they feel about themselves aside to assist people. And if they can't do that, fire them and move on. Do not lie to your doctor. Lying to your doctor is counterproductive. If you're going to the doctor to ask them questions about something that's going on with you, why would you be dishonest about that? I know there's a lot of videos online about people who eat whatever it is that they want, although the doctor told them not to do this or that, and then they go to the doctor and then lie. That's not going to help you if you start to have a major issue 10, 15, 20 years down the line and the doctor is trying to figure it out because you told them one thing, but you were doing something else. So as a patient, you should never be going to an appointment with your doctor blind and not knowing anything. If you have an ongoing medical issue, you may have some tests that the doctor advised you to go and take. If you have the results for your tests, you need to be able to at least have a basic understanding of what the results are saying. You can do that just by Googling. Like if you go and get blood work and you're looking at your ranges and they're saying, oh, your range is out of range, or even if they don't tell you it's out of range, you at least need to be able to know what the normal range is. Ask questions surrounding, how do I get to the normal range? Is there something in my daily routine that I'm doing that's preventing me to be in the normal range? Be able to speak to the test results that you have, dealing with difficult situations. I haven't had many difficult situations when it comes to a medical setting. However, I'll tell you this story. The first surgery that I had was a myomectomy, in which they basically cut my stomach open like a C-section. So I had been in the hospital for a few days and I had a nurse, but I had not had a shower. And at this time, I had really bad anxiety and I would just be sweating profusely. If you know anything about having a surgery, the last thing you need to be doing is sweating and putting bacteria on top of an open wound. That can cause an infection. I think I was in the hospital like 3 days and the nurse hadn't come and helped sponge me down or given us the proper things that we needed to wash my body. And my doctor showed up and I told my doctor what was happening and she was like, oh no, we're not doing that. And so as soon as she showed up, the nurses were switching shifts. And so she made sure to speak to the nurse that was on the next shift to let her know what had been happening and to make sure that I got a bath. And so that's what I mean about advocating for yourself, right? So you need to be able to speak up. Although I know a lot of times people don't like conflict, but you don't have to be rude or nasty to people. You just need to be able to voice your opinions and your concerns in a way that it can benefit you. You don't want to, call anybody out their name or talk about what they have on. That's not important. The most important thing right now is you, how you feel, and what you have going on. And the sooner that you communicate that, the sooner you can get assistance. Also, dealing with difficult situations. If you come across a doctor that is, brushing you off about your symptoms, and not really trying to assist you or get any tests for you that you may need to, you have the right to ask for that test. If they do not proceed by scheduling a test or giving you a referral to get the test, you can tell them the following: I would like this noted on my chart that on this day and at this time I requested to get a such and such test because of blah blah blah, and the doctor name said they would not proceed with that. As soon as you tell them that, I bet they will go and get you your test. I've done that and it definitely works. Legally, they cannot refuse any type of test that you request. But I will say, you don't want to be exaggerating about it. Like, you wouldn't want to have like period cramps and then ask them for like a spinal tap. Don't do that. So that's what I mean by preparing yourself for your appointment. You need to be able to know at least what kind of test you may need to take. So that is the end of this video, but I would like to empower you all to take the information here, share it with anybody that you can. Like, comment, and subscribe. There will be more great content like this coming, but you need to empower yourself. Take charge of your own health, because nobody's going to do it for you. It's your body, it's your life. And even if empowering yourself and taking charge of your health means just making better decisions, whether that be the food that you're eating or the things that you're doing daily, like working out or moving your body, do that. Nobody's going to do it for you, sis.